Hi.
This is Rachel.
Hi.
We're here to talk about your upcoming atrial fibrillation ablation procedure. We want to talk about things that need to be done prior to the procedure and what to expect during the procedure and afterwards.
So all patients prior to the ablation need to be on either Coumadin or dabigatran medication for at least 1 month. If you're not currently taking one of these medications, we'll start you on one today. Now, the purpose of these medications is to decrease the risk of a blood clot forming from the atrial fibrillation, even if you're not in atrial fibrillation all of the time. However, we also have to decrease the risk of bleeding at the time of the procedure, so we will have you stop these medications approximately 2 days before the procedure. During the time when this medicine is wearing out of your system, there is a small chance of a clot forming. Because of this, we will have you inject yourself with a short-acting form of a blood-thinning medication the day before the procedure.
So will I need to be on Coumadin or dabigatran after the procedure?
Yes, you will. So approximately 3 to 4 months you will remain on these medications. Even if you're in a regular rhythm after the procedure, during the recovery phase of the procedure, there is still a risk of a clot forming. One of these medications will be started on you when you leave the hospital. Now, if you're on Coumadin, this medicine does take time to build back in your system. So during the time when it's reaching therapeutic levels, you will need to continue to inject yourself with the short-acting blood-thinning medication. We will direct you how to do this when you leave the hospital. If you're on dabigatran, you will not need to inject yourself with the medication, but we will explain everything once you leave the hospital.
Secondly, in addition to the blood thinning medications we previously described, we will need to have you scheduled for a CT scan of your chest. This will help us target the ablation specific to your heart anatomy, and we will help get this scheduled for you. Now let's move on to the procedure itself. You will be under general anesthesia for this procedure. Once general anesthesia has been induced, we will proceed with a transesophageal echo.
What is that?
A transesophageal echo is a camera attached to a long tube that gets advanced down the back of your throat to look at your heart. This will help define your anatomy and give us guidance during the procedure. It will also help look for blood clots that may have formed with your atrial fibrillation. If no blood clots are seen, then we will advance with the procedure itself.
Will it hurt?
No, you'll be under general anesthesia when this is performed.
Small flexible wires called catheters will be placed in the blood vessels in your groin area. This is where the instruments used for the procedure will be moved up to your heart.
Okay, how long will the procedure last?
It typically lasts about 3 to 5 hours. You'll spend the night in the hospital and then likely will be able to go home the next day.
After the procedure, you'll be on antiarrhythmic medications.
I'm on antiarrhythmic medications now. Will they stay the same?
It depends on the medication.
So why do I need to be on this medication after this procedure if it's going to treat my atrial fib?
Well, your heart is in recovery phase for approximately 3 months after the procedure. There is some inflammation from the procedure, and it takes approximately 3 months' time to settle down. The antiarrhythmic medication that we prescribe for you will help keep your heart in a normal rhythm during this time.
Well, it sounds like I can still go back into atrial fibrillation after this procedure.
It is possible to go back into atrial fibrillation or have palpitations. Staying on the medication will help reduce your risk of going back into atrial fibrillation. However, should you have atrial fibrillation episodes, we will either modify your medication or, if possible, we may need to schedule you for a cardioversion. We're going to aim our treatment to keep you in a regular heart rhythm, which will provide you the best long-term success.
Now, if you are not already taking a medication called a proton pump inhibitor, we will start this for you after the procedure, and you will continue to take it for approximately 3 to 4 weeks. This medication decreases the acids in your stomach, which can then move up into the esophagus and cause irritation while you are recovering from the procedure. Although this complication has not occurred in our center, other centers have documented findings of severe irritation to the esophagus after the procedure. Symptoms to watch for if this occurs are persistent temperature, possibly persistent discomfort in the center of your chest that does not go away. Also watching for difficulty swallowing. If you have any of these symptoms occur, please call us immediately and we'll probably direct you to the emergency room to get more attention and further testing.
Do you have any other questions about the procedure?
No, I think I'm ready to have the procedure done.
Great. We look forward to seeing you on procedure day, and if you should have any questions prior to the procedure, please feel free to give us a call.